Alireza, thank you for joining us here at Abu Dhabi Global Healthcare Week, the first event of its kind here in the UAE. When you think about the possibilities that we're talking about, AI, technology, and the future of health, what stands out to you as the biggest opportunity?
Thank you very much. It's my pleasure to be here at the Abu Dhabi Global Healthcare Week. It's an exciting time for medicine because of all the new advancements in AI, genomics, and other fields. And this is an interesting area and region. We are in Abu Dhabi, which is now leading the excellence and innovation in the region. Answering your question in terms of the opportunities, we think that the combination of these two areas, the genomics and AI, can significantly help to improve patient care and public health. And that is in different aspects, from prevention to diagnostics to treatment. These combinations of the technologies and the advancements in the field enabled us to go even one step basically before and do predictive medicine, which will enable us to predict development of disease in a specific diseases in specific people.
And that all has to do with being able to map your genome, essentially.
Absolutely, mapping the genome, but genome is big data, and it's very difficult to make sense out of this data. So AI, this is where AI can help. AI can come and help to interpret the data, to identify patterns, and help us to understand about the biology and physiology using the genomic information at a scale that we were not able to do ever.
Yeah. We're talking about the future of health, revolutionizing the healthcare industry, if you will. When you think about that with regards to investment, this is a country that has a lot of capacity when it comes to putting in the money.
Yes.
What does that look like to you at Harvard?
So, as I told you, this is an exciting place to be. Abu Dhabi, specifically led by Abu Dhabi Department of Health, they have many initiatives and projects that are in the very cutting edge of science. The investment in this part of the world will change the field. We now have new players in the field of investment. Not only investment, but in science as well. So genomics, AI, historically, most of the investment has been done in North America and in Europe. Now, Abu Dhabi is leading investment in many of these areas and also bring partnerships with global collaborators and partners to advance these fields. And I think that the outcome and the impact of these initiatives will be beyond the borders of the UAE and even the region, and it will impact the healthcare and the medical science globally.
And one of the things that you and I discussed before we started was the idea that you can have all of this data, but you also need the people to interpret it. You need the physicians. What are you doing to create that environment and that ecosystem that's necessary for these advances to take place?
That's a very good point. So genetics and genomics, when you have the data and when you have the results, then you need to integrate these findings within the healthcare system of the country. So you need workforce, you need physicians and healthcare professionals who should understand genomics, can interpret the results, and then they should be able to communicate the results with people and then plan accordingly. So this is why that we have major partnership with the Department of Health of Abu Dhabi in clinical and translational research, but also in capacity building. In one of the groundbreaking partnerships that we have with the DOH, we are training a large cohort of Emirati physicians in genetics and genomics, and they will be the core team who will contribute to the Emirati Genome Program. They will be the team that will communicate the results with the people, with the nation, and would also use the results to improve care for patients and hopefully contribute to improving public health in the whole country.
How do you see the possibility of replicating a program like that one elsewhere in the world?
I think it depends on the leadership and the resources. So when you have a large project, a national project, you need to think about all aspects. It's not only the research part, it's not only the clinical part. You need to have like an A to Z solution. You need to be able to start a project, plan for it, do the sequencing, analyze the data, then communicate the results with the individuals and patients. And also you should have a clinical infrastructure that can provide services to the individuals who now have their genetic results in hand. So I think it depends on many factors, but I think that if there is a clear, good design plan at the national level, it's possible to do similar projects in other countries as well.
Alireza, when you think about the possibilities, how can the project that you're doing right here in the UAE contribute to understanding how to combat future diseases, prevent them, and potentially eradicate the possibility that you have them in the first place?
So genetic information is a very valuable information. It helps us to understand physiology, biology of health and disease. But to have a comprehensive understanding of biology, we need to have information about genetic makeup of different populations around the world. The genetic research has been historically focused on population of European descent. So we don't have much information about the genetics and genetic makeup of many populations around the world, including the population in this part. So Emirati Genome Program, which is a very ambitious project, I have to say, will significantly contribute to our understanding and our knowledge of human disease and health by generating data about the genome of specific populations that are not well represented in the current research of genetics and medical science. By having this information, you will be able to understand the role, the functional impact of genetic variants much better, to understand the roles of the genes, their functions, and also the pathways. So to have a comprehensive understanding about the genetics, we need to have genetic information from different populations around the world. This project is a significant contribution to this basically effort globally.
And you've just signed an MOU with the Abu Dhabi government. Walk me through some of the programs that you're working on with the folks right here.
Yes, we are delighted to work with the Department of Health of Abu Dhabi. DOH has ambitious plans to improve public health and patient care in the country. They have ambitious plans to advance medical science and research in the country as well. So we are delighted to work with them in different areas, from clinical and translational research to capacity building to data science and AI. And we think that the impacts of these collaborations will be beneficial not only for the UAE, it will help us in the US, my colleagues, to work on research projects, and hopefully the whole world would benefit from these efforts.
When one hopes. Alireza, it's great to have you here at Abu Dhabi Global
It was a
Health
pleasure.
Week. Thank you so much for joining us.
Thank you so much.